Eating organic, grass-fed, wild-caught, and free range does not change morbidity and mortality overall. So we were sold, the industry sold us that we were paying a little bit more per pound to get something that has like less antibiotics or less hormones, for example, but it's still pro-inflammatory, right? It still has cholesterol, which is heart disease. 3 people every minute die from a heart attack in the United States. It still has little to no antioxidants.
Inflammation. It's a word most people don't think about until they're confronted with it. So many of us are, in fact, living with inflammation right now, and we don't even know it. Why does this matter? Because inflammation is the precursor to disease. And fortunately, today, the guest we have on is an authority on this very subject. Author, radio host, and thought leader in the wellness industry, Dr. Sunil Pai is one of the first board-certified MDs in holistic integrative medicine here in the United States. His book, An Inflammation Nation, the definitive 10-step guide to preventing, treating, and reversing all diseases through diet, lifestyle, and the use of natural anti-inflammatories, offers solutions to defeat this silent adversary. So, for anyone out there suffering from chronic inflammation or trying to prevent it from rearing its ugly head, this is an episode you do not want to miss. So welcome Dr. Sunil Pai to the Switch for Good podcast. We need you very much to help us with our inflammation.
Well, thank you for inviting me today.
It's great to have you. So can we start first? Your book is excellent, has chock full of information. Let's start with the really basic question, because the word is thrown around a lot. What does it mean to have inflammation in the body?
Sure. So inflammation, just in short, is derived from the root word fire or flam. And traditionally, it used to be thought of just injury or damage, but we now know that there's a complex mechanisms that are going on, hundreds of them, that are actually upregulating and downregulating your immune system at fighting, fixing, and repairing. Okay, so let me just give you an example. So since the word flam or fire is the suffix is the word itis, then what we want to look at is any word that goes before it is this inflammation of that area. Okay, so now if I just start off with, say, my scalp, some people can have a dermatitis, is where there's inflammation in their skin. You know, people can get red eyes, conjunctivitis, runny nose, rhinitis, or sinusitis, or gingivitis, or they can get thyroiditis, or maybe even laryngitis from speaking too much or singing, or pharyngitis, where we get sore throat, bronchitis, esophagitis, gastritis, colitis, vaginitis, prostatitis, arthritis, right? So there's 200 different itises now, you know, from a Western medicine diagnosis. And we have to look at then what are the triggering mechanisms that are coming in that are causing people to have all these inflammatory conditions. It's not just treatment of the inflammation, but more importantly, it's looking at all the triggering factors. And we like to go and look at the root causes of people's inflammation.
And why is it bad to be inflamed?
Well, that's a great question. So in the beginning, you know, acute inflammation is important, right? So you have a little bit of injury or trauma. Say you sprain your ankle, and that's a cyclist, right? So there might be some injury or just overuse in workout. That's a normal response. The body's sending out inflammatory response and signals to kind of help coat or protect the joint. So that initial swelling is a good thing. It's a healing response, as you mentioned, right? So that's a great way of looking at it. But when there's too much inflammation, then it becomes a chronic problem. And then that becomes a degenerative problem. And it's too much, so much so that over time, then that degeneration can link to further disease or pathological processes where the body cannot fight, fix, and repair. And eventually there is higher risk of actually not only worsening condition, but actually cancerous type of conditions as well. So for example, with certain types of colitis that patients can have, you know, after about 30 years, 43% of patients that have chronic colitis turn into colon cancer. Or people that have rheumatoid arthritis for 10 years, they have a 71-time higher rate of getting a lymphoma from that chronic systemic inflammatory response. Or even just like women who get HPV of their cervix after about 10 years, there's a higher rate of those patients, potentially, some of them, not all of them, but turning into a cervical cancer. So this inflammation the problem is in the beginning is a good thing. And it's kind of like, I would say, more importantly, like the Goldilocks rule. You don't want to have too much or too little, just right. It's like the temperature on your thermostat. You don't want it too cold, you don't want it too hot. The challenge is when there's too much, then that becomes a problem. And then that's when the body cannot repair itself. And other diseases or other manifestations of illness or dis-ease sets in to actually have disease later on.
It sounds like the real difference is the difference between acute and chronic, because inflammation is incredibly important. Like if you do sprain your ankle, right?
Correct.
It tells the body to bring all the good, hardworking, healthy cells to repair and recover and regenerate. But the chronic inflammation is no bueno. And is it a disease in which the immune system becomes overactive over time? Is it always an immune system overactivity?
On some levels, yes.
Time?
So
Okay.
on the concept of an autoimmune disease, and I know that you've had rheumatologists and some autoimmune people in the past. So when they look at autoimmune, they say, well, your body's attacking itself. And on one level sense, it's true. Like we can test autoantibodies of different sources of different types on the panels of blood tests and say, okay, this is more of a rheumatoid picture, this is an MS picture, this is a lupus picture, for example. There's inflammation in this area of the body. However, the body never wants to attack itself to begin with. It was not designed. Your cell biology is actually more about preventing, fighting, and fixing, right? So it's like defending its borders. It's kind of protecting from foreign invasion, damage, bacteria, viruses, cancer cells, parasites, infections of all sorts of kinds of things, chemical exposure. It's designed to fix that. But what happens when there's too much inflammation, then over time, the immune system says, I'm out. And then it has this it's like I'm fed up. It's like union going on strike. We're not getting paid enough. We don't have a raise of minimum wage. We can't be working these long hours. I'm tired. I'm out. And then the body then attacks itself. It's like I have no more energy or reserve to actually do my job correctly. So we like to look at though, but when we look at just general injury, most people are just having chronic inflammation throughout their day, from the standard American diet to lifestyle, just to other environmental factors. So when we talk about, in my book, we talk about a stacking effect. Okay, so it's a little bit of this, a little bit of this. So the more fuel to the fire, the bigger the fire at the end of the day. And we have fuels coming in from a lot of little places. So it's not just, inflammation is bad. The problem is we're getting inflammation from not only what we eat, but also what we're getting exposed to. And even stress can cause inflammation. So even if we have someone who's eating a whole food plant-based diet, and we put them in the bubble, like there was a biosphere study, and they were all eating perfect diet, perfect oxygen, perfect everything, super triple PhD kind of astronaut type people in that study. But two of those people didn't get along in the study. Then when they measured all their inflammatory markers, they're off the chart. So that's in a controlled lab rat human study. But when you look at then our regular daily lives, who's not stressed, and school shootings and inflation and banking issues, and there's all these things outside the average person's life that's also stress, like financially or environmentally, climate change or tornadoes or wherever you live, there's floods or fires or droughts. That itself triggers inflammation in the body. So we're looking at how to reduce inflammation all across the board, body, mind, and spirit, environmental as well. So food is a large contributing factor, but we want to look at that. Most people are having an inflammatory lifestyle. And that's why my book's an Inflammation Nation, because it's not just, you are what you eat, or you are what you eat is eating for most people who are standard American diet, but we're also looking at all these other factors that are also pro-inflammatory.
We are trying to mitigate the cells when they become overactive and your body becomes inflamed. The cells start multiplying too quickly. Do I have that correct?
Well, that's in a cancerous situation where the cells are replicating because they don't have their apoptotic genes, meaning that there's a self-regulatory mechanism, like you have a certain expiration date. And cancer cells don't have that. So they continue to proliferate and reproduce and reproduce and reproduce. Inflammation is one of the aggravating factors that actually makes that cancer cell continue to grow.
Right, because you were saying that a lot of these, after 10 years, a lot of these types of inflammation, a lot of these types of itises have a 30%
higher risk,
chance,
absolutely,
right, as you go along.
Yeah,
and
absolutely.
So that's just that proliferation.
And that's just on cancer. But say, for example, like an athlete. Right. So someone who's an athlete, and say they have an injury, and a lot of people that I see, will have injuries a long time ago, maybe from college football, or maybe a car accident, decades ago. But if they're eating a pro-inflammatory food or have a pro-inflammatory lifestyle, inflammation just likes to go to those places that have any trauma, overuse, injury, or places where your immune system's not paying attention. So if someone has an injury to a knee, just give an example. Oh yeah, I was playing football and I got clipped and ACL tear, whatever, a little bit of arthritis in the knee. Now, 30 years later, they'll still say, well, I have arthritis of the knee. And why? Well, I'm getting older. Well, it's not to do with age. It's just you're getting more inflammation over time. Anything that you eat is pro-inflammatory, though, will go to those places of sensitivity in the body. So if anybody has trauma, which most of us either professionally or physically or accidentally will have some kind of injury, even just repetitive motion injuries, just working in retail, for example, or construction or whatever the person's job or occupation might put them in. So we have to look at that chronic inflammation, though, then goes to those places. And then they'll say, oh, well, I have arthritis. Well, you shouldn't be harboring arthritis. You're no longer playing football. You're not getting injured, but there's pro-inflammatory triggers that are coming in every day that's exacerbating and causing those areas to flare. But that chronic flare then creates chronic degeneration to those joints. So then it gets worse and worse and worse and worse over time. I want to clarify for the audience, because there is some, a lot of people hear about inflammation, but inflammation also can be like, in the last, 2 years of pandemic, virus, COVID causes a systemic inflammatory cascade in the body. And so the key was, inflammation can even come from a virus that people weren't even think. So it wasn't like I was working out or I was lifting weights or I was eating, animal protein, which is pro-inflammatory, or, other things in the diet. It's like I got sick and it created this inflammatory response. But now when we see, 1.1 million people have passed away, why Americans died more than any other country, it's because we have more comorbid conditions that are pro-inflammatory. And so it's just another stacking. So on top of their diabetes, heart disease, maybe obesity, blood pressure, et cetera, now we threw this virus that was basically gaslit the whole entire person. And then now 30% of people who have long hauler or long COVID, even if they were asymptomatic, is because there's a little bit of lingering damage now that has occurred from the virus. And then anything that's pro-inflammatory now has just crossed that levy point or threshold. And now they have like ongoing fatigue or long joint pain or respiratory problems or cognitive issues. So inflammation can come from anything. In the last 2 years, a lot of people learned about this word from a different perspective, was actually from an infection.
Right. And then ongoing stress from being stressed that you're still sick and you're still tired and you're still not able
Absolutely.
to
And I'll give you an example, like, being plant-based, right? And being a plant-based practice since 2006 is the data showed like, people who were plant-based who did get sick had a 79% reduction of symptoms, which was better than the third vaccine. So even if someone didn't want to take it, even though I'm pro, medicine, I'm not anti-medicine, I'm pro-patient, pro-safety, pro-data. But looking at that, it's like, well, hey, we still need to lower our risk of getting the long hauler, because even if you're protected and even if you had immunity, et cetera, you can still just get lingering symptoms. So how do you lower that? Pro-inflammatory is by eating an anti-inflammatory diet. Even in our Bosmeric, for example, that we have as our anti-inflammatory, is that we have double-blinded randomized controlled clinical trials, 2 of them now, that was used for COVID, for mild, moderate, and severe symptoms, because it's about lowering the inflammatory cascade, right? So the goal is like, we can take some of the pharmaceutical antivirals to kind of stop the replication, but those are not anti-inflammatories. So the goal is like, I always want to up the ante. I'm a doubling down kind of person, like by any means necessary, as long as it's evidence-based and we can show the safety and efficacy for it, then we use it, even though if sometimes it's not in the kind of conventional thinking. It's like, well, that's what they're using in other countries, or that's the data or evidence shows that will help lower your morbidity or mortality from an infection. We offer that.
Hey, friends and listeners of the Switch for Good podcast. Yep, that's you. I have some really exciting news. Dotsie and I have started a Switch for Good podcast Facebook group. We created it so we can build a community of fans that will help us improve the show and deliver on the topics that you want to learn more about. So we want to hear what your favorite content is, what you want more of, and what you want less of. And if you like the length of the show, Dotsie and I are always talking about the length of the show, right, Dotsie?
Yes.
We want to tailor our show around the needs and desires of our incredible listeners, almost 500,000 of you. And it's really simple to join. Just go to our Switch for Good Facebook page. That's Switch, the number 4, and then Good. And then click on Groups. And there we are, the Switch for Good podcast chat. You can post directly in the group, share ideas, talk to other listeners, and connect with like-minded folks. So go, run, join our Facebook group and tell us what you want.
I have a new neighbor who is a lovely human. She's probably about 60. She's really just kind and thoughtful, and I love her. And we did some yoga this morning, and I noticed her psoriasis is covering her entire body. She also mentioned that she has a couple of doctor's appointments coming up to change her medication because of how many different arthritises that she has. And I'm asking this question because that's, unfortunately, it's not the first person that said, oh, I have psoriasis or struggles with psoriasis and arthritis. And I'm wondering, to help people who maybe either are struggling from both or love someone who is, the first thing that I just, I wanted to be like, drop the dairy. If I were to approach her lovingly, it's very complicated. I personally think inflammation and chronic inflammation, right? And you wrote a whole book on it. You get into the weeds. And how might we approach our friends or neighbors or people that we love who are struggling with what is wrong? Why is their body doing this? And then a couple of simple, like, hey, maybe try this types of things. Some real world, like,
well, it's a great question. And if when you read my book, you'll read about my chronic eczema that I had. I was related to a food. Most people have eczema, or actually even more severe psoriasis. And my eczema was like a psoriatic type of eczema. So it was close borderline in the way it looked and when I flared, but that was all related to food. And so the key is when we look at, say, someone who has psoriasis and they're taking biologics, which are immunosuppressants, the thing is it lowers their flare in general. So they feel better when they're taking the drug, but it increases their risk of all sorts of other problems going down the line because you need your immune system to fight, fix, and repair. So those people at higher risk, particularly over the last 2 years, taking a biologic for their say their psoriasis or rheumatoid or whatever, and then there were more risk of getting COVID or longer COVID or complications of that, or more importantly, just getting cancer risk of just taking the drug. That's a black box warning on most of the
healing up if you sprain your ankle.
Right. Or just cut yourself, whatever it is, right? So the trade-off is like, you need to have some Army, Navy, Air Force, Marines in your body to do their job. You just can't say, well, we don't have the phone so no one's picking up, so no one's calling. That's the problem when we're looking at suppressing of symptoms. We're looking at healing the patient. And at the end of the day, it's looking at, keeping the inflammation down, increasing the immune system and strengthening it, not making it hyper, but strengthening the immune system, right? And then getting the microbiome fixed. Most of these patients will have food sensitivities, 100%. I haven't seen a psoriasis patient that has not had. And it's easy to reverse those things because you just need to find the triggers. You need to look at what's going on in their microbiome, which we do, all right? And it's not just looking at, oh, hey, just eat plant-based. One of the things that most plant-based doctors don't do, and this is where I think a lot of failures come in, is that your body has the ability and has the right to say, I don't like something in the plant kingdom either. We talk about sensitivities and inflammatory responses. So when we look at food testing, we're looking at foods that come in within an hour of someone consuming an IgE response, and something that happens a few hours up to 4 days later. That's called a delayed, right? And so most of these people will have something they eat now and later. And believe it or not, a lot of these foods are also going to be in the plant kingdom. You can have a sensitivity to kale or blueberries or tomatoes or apples or soy or corn or wheat. And so when people shift towards a plant-based diet, is what we teach people to do. And that's what the data will show you should be doing. The thing is, though, everybody's a unique individual. Your body can say, I don't like kale, or I don't like blueberries. And yet we're telling everybody, hey, you should do this because it's good for your memory or good for your brain or good for your inflammation or cardiovascular disease. But what happens when they do that, and now they're eating more foods that they haven't eaten before in the past in larger amounts, that's also triggering an immune inflammatory response. So the key is we look at everything: plant, animal, vegetable, grain, legume, seed, and nut. And we want to look at what's coming that's causing them inflammation, not only just from a generic, here's a pro-inflammatory animal protein, saturated fats, et cetera, salt, sugar issues, et cetera. But we want to look at, for that individual, what does their body even say? Because they might not like something like something like an apple or carrot, and like, oh, I'm drinking carrot juice every day, or some green juice, and they're not getting better. Sometimes actually will get worse. So we're always looking at what's the anti-inflammatory diet for each individual. And not those, doesn't mean that those foods are permanent. Those are certain foods that we're going to be able to actually avoid for a period of time, fix their microbiome, and then rotate them back into the diet, because we still want them to get the maximum nutrient density from the plant foods themselves.
Okay, so I can't say all that to her.
Eat less things that have mothers and faces. Start with that. It's like cut down on the pro-inflammatory foods, and all of a sudden they start getting a little bit better. But they will have, someone has that severe psoriasis without a biologic, there's more dysfunction, meaning it's a cascade of effects, right? But I'll give you an example. If they were to take Bosmeric, right, and to lower their inflammation, and they take it and it will make them feel better, it'll lower the inflammation, then that's the power of plant foods. Right? We're just making them into medicines, right? We're just concentrating certain phytochemicals. But what happens if your whole diet
what is Bosmeric?
Bosmeric
What
is
is it made of?
our natural anti-inflammatory that has 3 patented and a 4th ingredient. It's a curcumin C3 complex, boswellia PS, ginger extract at
Okay.
20%, and bioprene in a bilayer sustained release caplet. And so the idea is that we give that to them. Here's the clinical studies. Here's why we use it all the time. And it will lower over 100 different biological mechanisms of inflammation instantly. 20 minutes, they'll kick in, and it lasts over 8 hours. When they take that, that's also one thing about natural medicines and even foods, by the way, is that it's not just suppression, it's upregulation and downregulation where it needs to happen. Nature is kind to us. So for example, when we look at curcumin, it has over like 202 mRNA transcripts turning up, and also has 505 turning down. So it's kind of like we call multi-targeted and mono-targeted therapies when we look at plant phytochemicals, which we don't get in any kind of animal proteins, and we don't also get it in any of the biologics, because biologics are just one, like all the drugs we give are just one pathway, one trigger, like one receptor, but your body's full of thousands of receptors and thousands of pathways. So that's why when we eat a whole food plant-based diet, we're trying to fill in all these kind of categories of lowering inflammation systemically.
Now, can I just, wouldn't it be the best thing is just to have her do a test? One of you have a 10-step approach in your book to reducing inflammation. And one of them is to test for inflammagens. And wouldn't that an allopathic doctor be able to send her off to get a test? And then she would have an idea of what might be triggering the psoriasis and the rheumatoid arthritis?
So that's a great question, and yes and no to that answer. The reason being is because conventional doctors are looking, and we're trained only for looking at anaphylactic food reactions, like my peanut allergy, where I eat a peanut and I have to have an EpiPen with me. So we're looking at this 2% of rare reactions that people can have. So when a conventional doctor does testing, we're looking at like a panel of 8 foods usually: eggs, dairy, nuts, soy, eggs, shellfish. Those are the things that, commonly people, melons, when people eat it, you'll see on television or in movies like, oh, I get swollen lips, or I have an asthmatic attack, or I need an EpiPen. So they're not looking at things that cause inflammation just slowly or subtly. They're just looking at what is the inflammation that can potentially kill you, right? So thankfully we do that. But if they do that, then they're missing out all the other, say, 60 kind of common foods that you might be eating now that you don't have a life-threatening issue, and also the delayed foods that you can have as well. Now, if you go to the other side, if you go to the natural world and you go see a naturopath or a chiropractor or something, they can only get delayed reactions because they are not MDs, so they can't do the immediate testing. So a lot of people do things online. They can see things on the social media and like, oh, I ordered this food test. That's a delayed reactivity of the testing. We like to look at both reactions, because you're eating something like banana. It can have a problem now, or it can have a problem later. You want to be looking at both, and that's the challenge, because a lot of people say, oh, well, my doctor tested me, I'm negative. Well, they only tested you for 8 foods. Well, good. Then you don't have a problem with those 8 foods immediately, but it doesn't tell you don't have a delayed. Or I saw my naturopath, I tested 200 foods. I have these foods. Like, okay, great. Well, you have some sensitivities. They might bother you a few hours up to 4 days later after eating it, but they're not testing you whether it bothers you within an hour of eating it. So there's a disconnect, because how people are being trained in allergies or inflammations from foods, and more importantly, how people are testing is off.
Well, how do we then? It sounds like that we can't figure it out unless we do a true elimination diet, where we take everything out and then slowly put things back in and gauge the reaction.
Yes and no. So when we do our testing, we test for both, by the way, right? So we have panels, and that's what we've been doing. That's my specialty is looking at foods, because it's so near and dear to my own history. But when we look at that, the thing is that since most people can kind of, if they do an elimination diet, can find maybe a potential immediate reaction, right? So after they clear things out and they add something, they might notice that within an hour or something, I'm getting a little diarrhea or a little joint pain or headache or whatever it is. They might be able to kind of find that out. But on the delayed reactions, I mean, you've eaten dozens and dozens of foods over the last 4 days. And so what you're eating now, like today, today being Monday or Tuesday or Wednesday, like you can do the same thing last week, but it all depends on the stacking of the foods that you've eaten. And so that's why most people have flares. They have waxing and waning of their symptoms, and they can't really pinpoint it even when they do a diary. So that's why testing is important, because we can just go straight to what's causing the problem now or later of all foods: plant, animal, vegetable, grain, legume, seed, nut. And then we can say, these are the things that you should avoid for a while. Let's look at the microbiome, because a lot of people that have food sensitivities have a dysfunction of their microbiome. They'll have like increased intestinal permeability, what we call leaky gut, or dysbiosis, or overgrowth of some kind. These are things that are also making them have more inflammation in their gut that's triggering systemic inflammatory responses. So for us, going plant-based is easy, or I would say more simple, right? But the key is really finding those triggers that are throwing people off. So like the person that has psoriasis here, if we did a test, which we would do, and we would find it, the immediate thing is that as soon as they stop eating that food, whatever it is, their psoriasis and their inflammation will just go down immediately. Then we give them a natural anti-inflammatory just to accelerate that, because they've had this chronic issue. Most people have had these issues for decades. So why we use supplementation, by the way, as food as medicine, is because we're actually trying to reverse disease now, because people have been on this lifestyle, unfortunately, for decades, right? It's one thing if someone's like young, I'm like, hey, we can just do diet and move forward. But a lot of people, like, they already have pathology set in, they already have disease processes. So I'm trying to give them an advance on the reversal of the disease as fast as possible, and then backing off on some of the medications, or backing off even on the supplementation, because lifestyle, at the very end of the day, your epigenetics, diet, lifestyle, environment, belief system is what will actually then change RNA and DNA in real time. And that's what actually prevents people from having disease going forward.
Okay, so it sounds like it's highly personalized, but in your book, you do talk about the foods that are most inflammatory, the foods that are most anti-inflammatory, and you have this, what I mentioned was this 10-step approach to reducing it. Can you list the 10-step approach so we can get kind of an overview before we get deeper down into the specifics?
Sure. So we want to first always start off with eating an organic, non-GMO, plant-based, what we would consider the anti-inflammatory diet. So that's just general. Everybody's got to go plant-based. And even in then, I want to make sure that people know that whole foods plant-based is the gold standard, but I shift a lot of my patients because, it all depends on access, income, availability. Some people live in food deserts. Some people don't even know how the skill of cooking. And so I don't even mind using transition foods in the beginning, because the data will even show plant-based processed foods, although it still has issues, is still healthier than grass-fed, organic, and wild-caught animal proteins. That study was
healthier
done.
Meaning less inflammatory in the
Less inflammatory, has no cholesterol, still has a little bit of fiber, still has phytonutrients, right? So even shifting people is important, because it's a jump, right, in lifestyle when people kind of move over and say, hey, you need to eat, it's better to eat this way, and they're so it's a training, right? We've been eating one way for decades, so we use kind of the transition foods, and then we kind of then modify based on their food sensitivities, and then we go completely whole food plant-based, because then they want to get better. First, though, we have to kind of have this negotiation, right, from those patients. It's like, what is going to make me feel better? Because no one's talked about this. My doctor just says take this drug indefinitely. I'm like, well, why is this indefinite? Like, why isn't there, there should be a turnaround on the road to disease, and there is. You can reverse heart disease, diabetes, and cancer. We can improve outcomes in all our patients, but it's a set of a variety of things. And so eating a whole food, non-GMO, anti-inflammatory diet's the first thing. Second thing is, like we talked about, is testing, what is triggering those inflammatory responses in your body. Third thing will be detoxification. And we do something called Ayurvedic medicine here in our practice. And my partner, Dr. Maureen Sutton, she's the Ayurvedic doctor here. We do panchakarma, which is the traditional Ayurvedic ways. That's the word where actually detoxification comes from. Avoiding smoking is another step. Avoiding non-steroidal anti-inflammatories, which are like ibuprofens and naproxens, and there's a whole section on black box warnings. We can talk about that a little bit later. Decreasing inflammation by using natural anti-inflammatories like Bosmeric-SR. This next step, number 7, would be increasing the immune system functioning. So looking at vitamin D levels, or taking like, glucan 300, other things like even heart rate variability, stress reduction, meditation. The next step is maintaining glucose levels and avoiding excess salt and sugar. And if you've been following the news recently, the Congress is moving forward at looking at a new law that's going to be removing the amounts of sodium that's put in packaged foods. 500,000 people a year are dying from excess salt intake, and I think it's 1.8 million, all the stuff worldwide. So it's huge issues that we can just cut down on, just putting, even in plant-based foods, anything that's packaged, particularly frozen foods, just salt is the kind of stabilizer, the preservative that's cheap. And so that's something that, we definitely, those things are still pro-inflammatory, salt and sugar, excess of that. And then my 9th step is stress reduction through meditation and yoga. That's other ways that we actually can decrease inflammation by reducing the stress, and also increasing our immune system functioning, natural killer cell functioning, just doing breathing techniques or meditation or mindfulness every day. And then the last step is love and happiness, social relationships, faith, and spiritual practices, because we know that that's the other part of belief system. And so it's not just, diet only. If someone's stressed out or they feel lonely, like during the pandemic, so many people just kind of felt isolated, and so bringing that community back is also anti-inflammatory. Having some kind of understanding or belief system that your body has an innate ability to heal itself. We just need to give it the tools that it needs to do that.
Great, thank you.
you just devote a lot of time to sugar. Alexandra says she has a sugar, it's not an addiction, but you like it a whole lot. And you try to stay away from the processed sugar. Talk to us about the actual issues with sugar as it relates to inflammation. And I'm assuming I'm making an assumption we're talking about processed sugar, but like the sugar in blueberries, not so much.
Yeah, and I'm worried. We're never concerned about sugar coming from fruit as long as it's coming from the whole fruit. So I recommend people not drinking juices per se. Now, juicing is one thing if they want to do it themselves, but when they buy store-bought juices, usually they'll find out that there's actually added sugar to that, or corn syrup and other things that now there's been lawsuits between some of these companies that were advertising that it's just naked or clear or clean, and it's actually not. It actually had high fructose corn syrup and other sweeteners in there artificially. Anything that's coming from a soda company, you should kind of think twice if you buy a product. It's like that's what they're good at doing, is putting a lot of junk in it. So like, oh, I'm getting a fruit juice from this company that makes soda. I'm like, they probably didn't come with the right intention, right? They're transitioning the same person to buy the same higher amount of sugar because that's what they're accustomed to getting. So they're just kind of crafting it with some kind of fruit label or product. It has maybe 5% juice product in there or something. But sugar is a pro-inflammatory food, particularly when it's highly refined, because you're removing a lot of the minerals, you're removing even the fiber part of the plant, and even other health benefits. So most people, let's say they're getting a packaged soda drink, which has like 20 grams or more. I even saw some natural things at the store the other day, 38 grams of sugar just in a little like kind of lemonade kind of thing. And that's just pro-inflammatory. The problem is that increase of blood sugar, once someone starts getting insulin resistance, and now 70% of the population has some kind of blood sugar pre-diabetes or blood sugar problem that correlates also along with obesity, is that becomes a systemic anti-inflammatory state. So when someone has blood sugar levels, even if they're tipped over in their hemoglobin A1C just a little bit, 5.7 or above, they're already putting their whole body in a systemic inflammatory response. And that's why we then end up having things like kidney problems, retinal problems, neuropathy problems, erectile dysfunction problems, blood pressure problems, cardiovascular problems, because it's the tipping point. So blood sugar, and related to eating excess, highly refined sugars, because that spikes. Remember, when they remove the fiber from food and they put a lot of this kind of highly refined sugar, your blood sugar, your insulin spikes up, and then over time, it's just not able to capture that glucose enough. So then there's an insulin resistance where the blood sugar starts to elevate. So instead of eating the food and then all that energy coming back into the body as fuel, it's disconnected. Then that excess energy converts to lipids and excess fat and blood sugar problems and blood pressure problems, and advanced what they call glycation, AGEs, advanced glycation end products. This is where, like, when people have higher blood sugar problems, then they get like neuropathies and vision problems and cardiomyopathies and all sorts of, neurodegenerative diseases. Now we're looking at dementias and Alzheimer's disease, which is a big problem right now going on with all of us aging in the population. It's chronic inflammation in the brain. And we find that it's over decades. And even people that have mildly above blood sugar will have higher rates of those cognitive disorders as they get older.
And there's a test, right, that people can take to measure their inflammation response in their bodies as a whole. Is that helpful?
Yeah, there's a lot of, so I look at all these things. So if someone has elevated lipids, we already know they're in pro-inflammatory state because they're eating pro-inflammatory foods. If someone has an elevated A1C, they're already pro-inflammatory because they already have the blood sugar diabetes problem, right? I mean, you can do CRP. There's all sorts of interleukins. There's all sorts of inflammatory marker panels. Like say like a rheumatologist or, immunologist will have those tests. But literally you can just say, do you have any of these itis conditions that I mentioned before? And if they do, there's your answer. I don't have to do a test, right? Like the idea is like people have some kind of ache or pain or dysfunction. That's the proof in the pudding, because when they're coming in for a reason, but the idea is that we also can take someone who's even healthy and make them even healthier at the end of the day. So
you were talking about sugar to go off on the Dotsie's question, things not to eat. What are some other things not to eat? And then we can so anything that's pro-inflammatory, which is animal protein and saturated fats, right? We want to cut down on the highly refined sugars, right? Which is, and salt, which is mainly on the packaged foods and frozen foods, which is where we get most of those things. I always tell people, just don't eat anything from a car window, number one. That's just the rule. Start with that, eat less mothers and faces foods, right? Those are simple things that you can do, because when people just go to Whole Foods, it's a great way to do it. That's the gold standard, but we want to kind of slow it.
There is a really big difference between the window food and then, the whole group that's like, it's a face, it had a mother, but it's all the things, right? Grass-fed, lavender massaged, put to sleep before they died, all the crap. But there's a large group of people that think, I mean, there is a difference between those two, but it's not as big of a difference. It's not as big a difference where you wouldn't still not eat something with a mother or a face, right? So
let me clarify that, because there is. So eating organic, grass-fed, wild-caught, and free range does not change morbidity and mortality overall. So so we were sold, the industry sold us that we were paying a little bit more per pound to get something that has like less antibiotics or less hormones, for example, but it's still pro-inflammatory, right? It still has cholesterol, which is heart disease. 3 people every minute die from a heart attack in the United States. It still has little to no antioxidants. Now, a grass-fed, wild-caught, or free range may have a little bit more, but it's still overall lowering. 99% of factory food in America right now is factory farmed. So yeah, somebody might get a wild-caught salmon here or a grass-fed burger here or there, but they're not eating it 3 times a day in all their meals in all the restaurants, because the restaurants are all factory farmed. Fast food is all factory farmed, if not even real food, right? It has no phytonutrients. So whether that's grass-fed or wild-caught or farm raised, there's no phytonutrients. Phytonutrients are all the rainbow colored particles and flavonoids, resveratrols, curcuminoids, you name it, beta carotenes and sulforaphanes, all these things that you go to the health store and buy. There's no chicken pill, there's no chicken pill, there's no pork pill, there's no bacon pill, there's none of these things that are for preventing and reversing diseases. And in fact, the fish is actually the fish oil, it's not the fish protein. Right. So a lot of people think like we need those things, but those things all are pro-inflammatory. They have heterocyclic amines, TMAO, insulin growth factor. They increase the blood sugar problems, the intramyocellular lipids and inflammation. So it actually, animal proteins, even if it's wild-caught, grass-fed and farm free range, will actually decrease still metabolic rate. And people are trying to lose weight. Right. So plant-based diets just have the opposite of everything I said. So that's the goal why we're trying to shift over to an anti-inflammatory diet rather than a pro-inflammatory diet. If people truly understand those two things, like the difference between an anti-inflammatory protein and a pro-inflammatory protein, then they'll tend to slowly move over. The problem is everybody's trying to redefine the industry. It's like, well, let me just get a cleaner food. Cleaner didn't get anybody healthier. It just kind of made us have the bragging right that we were buying something that was more expensive. But at the end of the day, their cholesterol is still the same. Their inflammation is still the same. Morbidity and mortality is still the same. So organic versus non-organic meats didn't show anything. So even though we all did that when I used to be that way, I used to make sure my eggs came from Taos and they did yoga and sung kumbaya, and then my massage beef from Japan, and I was the guy that was just like that. But that didn't improve or anything in terms of the numbers or lowering my risk of diseases going forward.
It wasn't until you got rid of them.
Until you got rid of them.
Pro-inflammatory. You can't. So in other words, trying to massage a pro-inflammatory food into something less inflammatory really doesn't work. Just we need to get rid.
We need to eat less
triggers.
of it. And the more important thing that now we're learning in the last 5 years, more importantly, with microbiome, is that animal protein causes dysbiosis. It has endotoxins, regardless of where you buy it, regardless how you cook it, regardless whether you boil it, it has endotoxins in there. And the endotoxins causes dysbiosis, which is an imbalance of your microbiome. So animal protein has no fiber. Fiber is what actually your microbes live on. It actually feeds on short chain fatty acids, which create something called N-butyrate. N-butyrate is the energy molecule that your microbiome survives on. It's like the CoQ10 of the gut, but those are anti-inflammatory fuels. And if the people have less of that, actually have more pro-inflammatory aspects. That's why when they have animal protein diets, they have constipation, right? Because it's not feeding the microbes to do their job. We just thought that the fiber was just a bulking agent, so if someone even took like a Metamucil or Benefiber, kind of a product to have them have a bowel movement, that's fine. It's not fine because it's not feeding the microbes. What they need is food to actually do that. That's why when people take those fiber supplements, then they still have to take a fiber supplement to have a bowel movement. But if you eat the right type of food, your body does it naturally.
So you're saying that because I always thought like the Metamucil or the Benefiber, I thought that was part of a real food. It was just, is it not the wheat husk or something?
So it is, but it doesn't have the phytonutrients, right? So it's like your body wants color. It wants food, like your microbes actually. So in fact, if we did testing on you, we'd find that if there's any kind of dysbiosis, that also might explore or explain why there's sugar craving. It's not your craving at the end of the day. It's your microbes craving. That's what all the data is showing now, right? So all these things that we kind of we think is ours our favorite thing is actually our microbes' favorite thing, whether that's good or bad, because sometimes, chocolate is like, we like it or this or that. But some people like, I crave sugar. It's not you craving sugar, it's your microbiome is craving sugar. So we have to look at what, and a lot of times when people have some kind of dysbiosis, some of those dysbioses are more prone to actually engage or want to have that feel. So it kind of becomes a love-hate relationship. People eat it, they feel good, but then they feel terrible. Right? Yeah. Like I feel I need it, but then I feel like exhausted and tired after I eat it. And it's not a blood sugar problem, for example. It's other aspects of the dysfunction.
It also makes sense of what you crave, what you eat, is your microbiome, and why people can kind of change their cravings in 3 weeks or 4 weeks.
Right.
Now
the good thing, I just wanted just as a note, because I'm not a perfectionist, I'm a risk reductionist. But that means I take my patient with all their cofactors, all their comorbidities, and we reduce the risk in all these factors, right? Diet, lifestyle, environment, belief system. So it's not always about being perfect, by the way, right? Because the interesting thing is with microbiome is when someone's eating plant-based, right? So it takes about 2 weeks to start flipping the microbiome. Boom. Okay. And once we eventually get to 30 grams of fiber a day, which is the goal minimally, right? Then the microbiome is fantastic. Now, if say a holiday comes up, and say it's 4th of July and someone eats an animal protein, interesting thing is those pro-inflammatory metabolites are no longer being produced from that one-off exposure. Now, I'm not advocating. I always tell my patients, like, try not to avoid eating these foods. But there's times that people get stuck in an airport, or they're at a church function or something, or a graduation or a holiday, and grandma's coming in and you got to take a bite of something that they've made or whatever. Then I don't want people to feel like, oh my God, if I eat this, that everything that I've worked on is going to go away. So no, the body bounces back. But if they're eating it regularly, then those toxic metabolites build up, and then the microbiome will then flip because it's trying to figure out how to digest those undigestible foods.
I love being able to blame my microbiome.
I'm telling you, in Hollywood, that's going to probably be the new get off of jail thing. It wasn't me, Your Honor, it was my microbiome that made me do it.
So you've talked a lot about foods.
Should have explored that defense, Alexandra.
That's right. That's right. So you've talked a lot about the foods that are pro-inflammatory. Help us learn. And you talked about processed, GMO, sugary animal foods, right? Those are, am I covering it?
Correct.
And lack of fiber. Tell us about the foods that are important to lower inflammation that we could be adding to our diet to help us.
So the simple way when you look at plant-based diets is two things. Is first looking for color, because all color has a phytonutrient. So like if something's red, okay, so like watermelon and sweet red peppers or tomatoes, right? They have lycopene. Oranges and squashes and carrots all have like beta carotene, and we can look at folate from green leafy vegetables, and then the indols and allicins and the sulforaphanes from the cruciferous vegetables like broccoli and those kind of things. Blueberries for like the resveratrol, and then all the beans and lentils, legumes for the fiber. So every color that you eat, the more rainbow. I know this is kind of controversial because some states won't let you say rainbow, but the rainbow color foods are important, you know what I'm saying? And that's the key, because interesting thing is that when we do testing for nutrients, what people don't realize is that antioxidants, which are all these colored foods, ACE, CoQ10, glutathione, and those kind of things like that, those are actually indirect anti-inflammatory molecules. So when I give curcumin in my Bosmeric and ginger and boswellia and black pepper, those are direct spices and foods that are anti-inflammatory. But when people are eating more vitamin A, C, E, and antioxidant pro-rich foods, those are also anti-inflammatory indirectly. That's a secondary action. So that's why when people shift it, so when we look at our patients, we actually test the nutrients, because a lot of people are like, oh, I drink a green smoothie, or I'm eating a power salad. And I'm like, oh, that's all good for you. Please do that. However, we want to look at, just like when people check their cholesterol and their blood sugar and their thyroid levels, like what is your nutrient levels in terms of, are you absorbing? Like, what is your digestive enzymes? Are you getting enough protein and fats and fiber? And are you absorbing? Is there dysbiosis or inflammation in your gut, or any kind of mycology overgrowth or parasite or candida or bacterial overgrowth? This all affects how those food nutrients will play a role in their body healing. And so the goal is, a lot of people will shift their diet, but if they're not fully feeling better, and there's like, hey, I did this challenge, or I started eating this way, my friend lost all this weight, they have all these positive benefits, but they're still struggling. Like, how come my blood pressure is still up, or how come my A1C didn't drop as well? Is because the body's not assimilating or digesting or excreting as correctly as it should. So just because we eat it doesn't mean that we're absorbing it. And that's one thing that we have to go further with individualizing our patient. Otherwise, they'll be eating more and more plant-based, but then over time they might get discouraged because they're not doing as well as everybody else.
So you mentioned curcumin, which a lot of us have heard of, and black pepper, but Boswellia is something that I'm not familiar with. You did talk about it in your book. Can you
Yes.
share with our audience what it is? Can you get it in the spice
Bosmeric, yes.
style?
So it's not a spice. It's actually it's from a tree, and it's actually a gum resin of the tree. So when you think of like the classically Americans will think of the gift that the Magi brought to baby Jesus. Okay, it's frankincense. Frankincense is Boswellia, right? Frankincense, myrrh, and gold. In fact, some of the connotation is that the gold would have been turmeric at that time because turmeric was being sold and the spice trade was more expensive than gold. So, and usually they would carry those kind of three things together. Myrrh is actually Google, not the website, but it's another herb. These are the three things that come from India. That's where the wise men from. But anyways, another discussion. But so Boswellia has a lot of anti-inflammatory effects, and what we've done is we've been able to extract the three main components, something called polysol, which is we're the only one in the whole market now that has a patent on that aspect of the frankincense that actually has a 20-minute onset of action. So when someone takes it like a fast tab, within 20 minutes, we're lowering the inflammation. Has great inflammation effects on the lung and brain and all over. But when you use those things in combination, Boswellia, and we have all the three parts, AKBBA and boswellic acids and the polysol. So we have the right ratios. And you combine it though with the curcumin and ginger and black pepper. It took us 6 years of doing different studies, looking at getting the right doses and the right potencies of those phytochemicals to create what we call maximum synergy. The reason why we cook with spices and the reason why we make formula in Ayurvedic medicine or Chinese medicine is because there's a synergy of effects. There's things that are augmenting 1 + 1 = 3. And also, how can we prevent someone from building tolerance of taking a drug? Where in Western medicine, it's always like a single pathway, single agent magic bullet. I don't think we should be carrying guns. I'm looking at the sprinkler system effect. I want to kind of be tuning down and turning down all the things correctly, but I don't want to have to use a power fire hose and then kind of spray the whole thing down. And yes, I put out the fire, but I might cause some kind of damage elsewhere. So when you actually look at the blending of these things, natural anti-inflammatories like Boswell and PS in our Bosmeric, that's a unique thing that people can take. And that's kind of the first aspect that everybody can do, because when everybody right now is going to go get an NSAID, 30% of the population uses some kind of ibuprofen, Motrin, Advil. Those are the brand names, but, naproxen, Aleve and those kind of things like that, or even prescription ones, tramadol and other things, or even opioids, for example. But we want to look at is why opioids have an addiction, for example, is because they're not anti-inflammatory. Right? So it helps the mind perceive there's no pain, but once it wears off, the pain is still underneath them. So the addiction occurs because there's never pain control. You have to lower the inflammation.
Like an Advil is.
So Advil lowers one pathway of inflammation, where Bosmeric will lower about 102, right? Now, Advil, which is, ibuprofen, has a black box warning. And the black box warning basically means that you can have a heart attack, a stroke, or a GI bleed at any time taking that drug, even just one time. Yeah. So, hey, I ride my cycle. I'm a little sore today. I take it. Or I have a menstrual cycle once a month, or I just got a headache, or, I'm just cleaning my house. I was moving my furniture. I kind of hurt my back. I take that. You can have a heart attack, GI bleed, or stroke at any time, even if you're plant-based and your cholesterol levels are normal and you don't have a blood pressure problem. Right. So the number one cause of death outside of lifestyle diseases mean heart disease, right, is number one lifestyle disease. But the larger death per year is side effects of Western drugs and medical errors. And of that class, which is more than heart disease, by the way, is the NSAID class. Now, why people don't take that off the market is because every time you open the pill, you've accepted the terms and conditions of that black box warning. My book goes into the detail of black box warnings, by the way, for those people who are trying to understand like what a black box warning is. Not every drug has it, but when a drug has it, you better be paying attention, because that means those things occur commonly, not rarely, but common enough that if it does happen, you end up in the black box. And people used to think that was just a little black box on the printout. The black box they're talking about is the casket.
It doesn't seem that scary. I don't know of anyone that's died of taking an Advil.
So, but people who die of heart attacks and GI bleeds and strokes, right? Number 1, number 2, number 3, right? So of those people, you can go back and say, but gosh, weren't they taking something that was lowering their cholesterol? And wasn't they taking something where their blood pressure was normal? Yes. So they all have comorbid conditions. But the thing is, it puts that risk having higher. So when you see like patients over 23 years, you will find this, right? So like, but like when a family or friend of yours if they end up in the hospital with a heart attack, yes, they have high cholesterol in general, maybe, Yes, they might have high blood pressure in general, maybe. They might have a blood sugar problem, but the universal thing that 30% of them, all these people are taking are NSAIDs, which push them over the top.
Might be from that, right?
And one of the issues is that what you're doing is you're lowering the inflammation, but you're not dealing with why you had the pain in the
You're not
first
fixing
place.
it. And exactly. And more importantly, for most people who take an NSAID, it's usually for joint pain. And so the data will show, and I have a whole section of my book, citing all the studies. I have like thousands of references in the book, right, of 500 pages. But it's looking at like over 2 years of someone taking an NSAID, there's actually joint degeneration that occurs that is even visible on X-ray. Right. So when people are looking at, so most people will take an NSAID and it's like, oh, I just took it once, for my knee pain here and there. And then it's like, it becomes, now I'm taking it once, twice a day. And eventually it's like 1-3 times a day. Now I take 2 of this and I take this other one. Right. So they start stacking it. And the reason being is because it's actually causing more degeneration of all the components of the joint structure than it is lowering the inflammation, because that's the side effect of the drug. Now we have data showing that it's dysfunctioning the microbiome, which we didn't even know. Right. These are things that we're not looking at because these are things over the counter. Like they're not studied for this. These are just, now we have to look back and go, what are all these people doing? And now look at the things that we took for granted that, hey, we can go to the big box store and buy a bottle of 2,000 caplets for $10. Right. So it's like, why isn't it studied? I'm like, yeah, the study says that you can have this, and you take it, buyer beware. And
that's the thing, is that because it is over the counter, we treat it much more lightly, like you said.
I know.
So if someone were to take curcumin or ice that issue, would that have the same quick effect? Or is it something like, what would you recommend to someone who was moving a television and got their back out of whack a little bit and wanted some relief?
Correct. Like icing it, putting heating pads, icing it, that's a great idea. There's also technologies that can increase, microcirculation, increase nitric oxide production. There's a lot of things that we can heal injuries really quickly, but taking a natural anti-inflammatory is great. The challenge is in the marketplace is getting them the right ones, because right now when you say curcumin or turmeric, 43% of that on the whole entire market is synthetically made now. So if you go to the largest online retailer right now, or you go to the fancy whole health food store, 43% of all that is synthetic.
How do we know?
Because it's been tested.
No, but how do we know that it's synthetic? Like, how can we say I don't want that one? It's synthetic. Does it say on the bottle?
That's the problem with dietary supplements in general. That's why when we look at ours, we're looking at, that's the challenge, right? Because the average person is going to say,
it's not in a black box.
It's not in the black box, and I can just go to the store and it sounds like the same thing. I go, it's not the same thing. It's made with solvents. It's made one curcuminoid. It can have side effects. People can have allergies. People can get actually rashes and diarrhea taking it. So that's why when people take a supplement, sometimes they go, I had this problem. It's opposite of what they thought. It's usually because it's adulterated or it's synthetic or it's not exactly, meeting the labeled claim. And so when we look at potency, purity, efficacy, and safety, I mean, that's what I've been doing for 23 years. It's like formulation, but also formulation from manufacturing, from clinical studies, all the way from a trial, from a farm, all the way to the study, to the trial. That's how we provide the food as medicine. The challenge is right now is that everybody's just going to go right now to, Google something and whatever the first thing shows up on the online retailer, like an Amazon, it's like, that's all marketing. The number one product right now that's being sold in this category, for example, when we do the analytics, their base cost, selling at $19.95 will be less than $3 all in, meaning the packaging, the bottle, the capsules. You cannot even get some, the cheapest thing falling off the back of a truck in China still would cost more, right?
Well, I was thinking more the spice aisle. Are they synthetic?
Oh, yes.
That's what I use. Why would we have to swallow it? Why can't, curcumin that you're
so curcumin is 3 to 5% of turmeric, right? Okay. So it's not the same. So again, that's where people don't understand. Like that, and even the marketing, they interchange them. They're different. Turmeric is turmeric. So when you buy the spice, you're buying turmeric. You're not buying curcumin. Okay. So that's interesting. Now, can you get important compounds from there? Yeah, there's 100 compounds in turmeric that are very helpful. Please eat that every day if you can. You can make yellow curry, make Indian food. Great, great, great. However, when we're taking that 3% of that, so say if you get a pound of turmeric, you're getting then 3% of that pound is curcuminoids. Right. Then we take the extraction. So what we're trying to do with natural therapies is we're trying to give a biological effect that's stronger than eating something for the last 40 years, which you haven't done. Right. It's not saying that the spices are wrong. In fact, I'm actually doing a monthly a thing on YouTube about spices, right? I'm talking about 4 spices every week or every month to introduce people the healing part of spice, the anti-inflammatory parts of spices, the spices for your brain and your digestion and lowering diseases. That's where we should be using the food. But a lot of people who go plant-based, unfortunately, don't eat a lot of spices because we're not trained with cooking. So they're like, oh, I steam my kale, my quinoa, and this, that, but they're not talking about ajowain or, curcumin or black cumin seeds or, cinnamon or chili or other kinds of, caraway, or, I mean, there's tons and tons of different types of spices. But the thing is, when someone has a headache or someone has back pain, it takes a little bit of time. Now, I also explain and I teach my patients also how to do things like you can do this daily, then it'll lower your overall inflammatory burden. So then you don't get that peak. Obviously, we'll do that. But for most people, we need to convince them immediately because they're going to go. Otherwise, they're going to say, well, I'm eating this way. I got a headache. I'm just going to go to the pharmacy store and buy something and take it over the counter, right? Not knowing that black box warning or the degeneration or their microbiome dysfunction or kidney problems and all these things that we now know are occurring, but it's never solving the problem. It's just treating it, the symptoms. When we use the natural therapies, though, again, since we're upregulating, downregulating, we're also getting preventative benefits. So we're turning down inflammation, which is preventing the person, their telomeres from aging, right? So it's an anti-inflammatory process. It's an antioxidant process. It's lowering their cholesterol indirectly. It's lowering their blood sugar indirectly. It's lowering their neurodegeneration indirectly. So if they take it even as a preventative, they don't have to take high doses, but if you take the right thing, that's the strongest thing that you can get a return on your investment.
So all the external things that we can take in, right, like we've just talked about, are important, but you also really believe that just from an internal perspective, lower stress and even finding true meaning in your life are just as powerful
It's just as powerful.
To prevent inflammation and boost.
Yeah.
What or where are the studies that show that? Are there studies that show that? Can they even do studies that
Yeah,
that
so
show that?
so there's a lot of studies looking at what they call heart rate variability or heart rate coherence. Okay, and it's not the electrical impulse. It's not the heartbeat like a Fitbit or Apple Watch will be like, so like how is my heart rate going? We used to think the higher the heart rate, the more the stress the patient, and the lower the heart rate, like a marathon runner would have a low heart rate. We thought it doesn't, because marathon runners have the highest rate of sudden cardiac death, meaning they go and they just drop dead more than anybody in the population. So it's the stress. So what happens is, like, now they have studies where we can measure, like, through biofeedback, right? And we offer our patients, we say, hey, there's nonprofit companies that have these like biofeedback app devices, and you then can measure your heart rate variability. Now, if you meditate or find a meditative type practice, and the goal is, from what we teach is, again, I'm a risk reductionist. Okay. So I say, put it on and then find your meditation. We can teach meditation every day in our practice, but the idea is that for everybody's different, right? Wherever you come from, your background, your city that you live in, your religion, or your community that you like. So for me, it's like if someone watches cat videos on YouTube and their coherence is nice, then that's their meditation. Like, it doesn't have to be this perfect thing that we always kind of thought from an Eastern perspective. Like, I'm clearing my mind, I'm thinking of mantra, or thinking of a sound, or of an image, and to get you there. There's even active meditations. Like, I'm a music person. You read my book. I can put the biofeedback on my ear. I can play my drums within 30 to 40 seconds. I'm in that zone, right? So, and you being an athlete, you know what that's like when you're in the zone. There's like time and space. Everything's like, I can just be on the track, or I can be doing my exercise and fitness, and time goes by really fast. You're like, I didn't know 3 hours just went by, right? So there's ways to actually do that. But what the studies will show is that it not only lowers inflammation. So they have wonderful studies, randomized controlled studies, by the way, on this, right? Where someone can do this, eat a diet, and someone can just be in this calm, focused state, and it lowers the inflammation. It also increases natural killer cell functioning, meaning your immune system goes up. So the whole goal is putting people in a parasympathetic, relaxed, focused state. And that's what meditation yoga does. That yoga is preparation for meditation, actually. It's not just an exercise. It's what the Western world has kind of sold it as. The goal is, though, is that if someone's, super stressed about their diet, that's not helping them as much as you think, so even though they're cramming my green smoothie, I'm spending hours doing, with my mixers and my juicers and all, then, they can cram the nutrition in, but their body's assimilation is not as effective because it's still in a pro-inflammatory state. That's the level that we go to. So the idea is that when you have 10 steps, you got to do a little bit of all 10 steps. You don't have to be perfect in everything, because it's all about reducing all your comorbidities and risk factors, but it's not being perfect in one. If you can get perfect in one, fine, but you still got, someone's really, really crushing with the diet. If their microbiome's off, they're not feeling well as well as they should. If they're stressed, then the nutrition is not helping them as much as they would think. So these are things that you can easily do. We talk about that heart rate variability meditation a lot.
Dotsie started us off with a real world story of her neighbor. Can you tell us your real world practices that you do every day to keep inflammation at bay?
Sure. I mean, so I'm plant-based, as you all know, right? And I tested my food sensitivity, as you all know. So it's key to really focus on those things first with everybody, because that's their biggest trigger on it from any food, by the way, right? Because that gives them the biggest jump ahead. Like, oh my God, this is something that I just didn't know indirectly I was coming in that was just making everything a little bit off, right? So I eat a plant-based diet. I'm not a perfectionist. Now, I don't eat animal protein at all, but do I have packaged food every once in a while? Sure. If I'm late to some place, or I have something like in our office, I don't have a full kitchen, sometimes I'll open up a packaged thing, but I have to be careful of too much salt in some of those things that can also raise blood pressure and stuff, just like everybody else, right? I do a practice meditation every day. I do yoga every day. I walk every day. I'm trying to do a little bit more weights. That's my new thing for this year, trying to be a little bit more athletic from that standpoint of gaining some more muscle. So that's my goal. Like I'm trying to, so I do the other things like the walking, the yoga, the stretching, those kind of, my balance is fantastic and all stuff like that. And also working on better sleep hygiene is another key important thing. Hydrating, which I encourage everybody to do, is hydrate. We don't drink enough, but sleep hygiene is also important, because sleeping is where our body's and storing itself. Its immune system is actually fighting, fixing, repairing the most. The problem is most people have some kind of insomnia, sleep problems due to pain or just other things going on, racing of the mind. And so there's natural ways that we can also help people with sleep hygiene. But that's one of the things that even myself, because there's so much stress going on these days, right? Who's not worried a little bit, or who's sometimes having difficulty, sometimes falling asleep at night. So those are the things that I myself work on every day.
How can we find out about your book and your work,
Sure.
your book and Inflammation Nation, which I highly recommend, and your work as a whole?
So you can go to sanjevani.net. That's spelled SANJEVANI.net, or Sanjevani Store. You can get a copy of my book, SANJEVAN store.com, and get a signed copy of my book, or Bosmeric, or any other natural products that we offer. Or you can go to Amazon and get those things as well. And it's also the books on Audible as well, for those people who like to listen to it.
Thank you very much for being on our show, Dr. Pai. It's been fantastic.
Well, thank you for inviting me. I look forward to seeing you sometime in the future.
Hey, folks. Okay. Back by very popular demand is our plant-powered plate fridge magnet, which you are going to receive for free if you leave us a rating and a review on whatever platform you're listening to this podcast on. So here are the details. Just write your quick review. Does not need to be long, does not need to be a whole story. Just be honest and speak from the heart. Then take a quick screenshot of the review you wrote and email it to us at podcast@switchforgood.org. That's podcast@switchforgood.org. And include your mailing address so we can send you a power plate. We are doing this because the more reviews we garner, the higher we go in search results, which means more folks will learn about our podcast. So the power is in your hands. Leave us a review, and zoom, zoom, your power plate arrives at your doorstep.
So thank you so much for tuning in today. If we helped you in any way, then click the subscribe button and let's keep hanging out together. We have so much more to share with you.
And if you need more information on actually making the switch for good, please visit us at switchforgood.org for loads of info. And you can subscribe to our mailing list, where you will receive all sorts of super cool gifts, discount codes to our very fave dairy-free products, and a lifetime of powerful health tips.
So join us on the journey to switch for good. This is the future.